What is vestibular migraine and what causes it?
So, dizziness and headaches are individually really kind of common conditions that we see. But when they're together and the combination of them can actually be pretty complex. So, working with your neurologist or even neuro-otologist to go through diagnostically kind of a couple different criteria. The International Headache Society actually put out some pretty specific criteria that's used. Some clinicians use it, some don't. But with regard to what the International Headache Society set forth, we're looking for 5 different episodes that are kind of filling in the criteria with vestibular symptoms. So usually you're going to have an episode of dizziness or spinning that's going to be moderate or kind of severe intensity that'll last anywhere from about 5 minutes to almost like 72 hours, which is pretty debilitating. And then about 50% of the time, you're also going to have migrainous symptoms or features. And so that is kind of the classic migraine association that we all have, which is going to be like a unilateral location or on one side of your head, pain or discomfort, usually like a pulsatile quality to it. So it feels like it's kind of thumping or kind of surging a little bit. The intensity of it is usually described as moderate or pretty severe. So it's not going to be like a mild kind of description. And then usually it's aggravated with a lot of physical activity. And so if you move around or if you were to go for a run or a bike ride, it would actually get worse. So, half of the time that criteria actually has to accompany a headache, along with light sensitivity or sound sensitivity. So there's a lot of puzzle pieces that go into it. A lot of clinicians will very quickly, and a lot of physicians very out the gate will be able to say that it literally is a migraine with vestibular symptoms. And that's criteria enough for a lot of people to work through the actual diagnosis. So even though there's not one specific test that's going to be able to, give specificity in the actual diagnosis, we are looking at clinical patterns and then really working through and excluding any alternatives. So that's going to be one of the most important things. It's very, very important for a lot of people to understand that you do not have to have a headache to actually have a diagnosis of vestibular migraine. So that's usually where a lot of patients get confused and lost, is if they don't have classic migraine symptoms all of the time, and they don't have that headache associated with the dizziness all of the time, they just kind of assume that it can't be vestibular migraine, and that's not the case. So it's important to understand it's only about half of the time that the headache's actually happening.
Yeah, I can see how that could be a little bit confusing because you bring those two words together and you assume that you got to have both, but it's not necessarily true. Is there any indication of necessarily what causes it, or is that still up in the air?
Yeah, I mean, that's where it gets kind of complicated. It's not really understood. The complexity of vestibular migraine is kind of still up in the air. So there's a lot of thoughts behind it. As far as the cause, one of the biggest causes is thought to be just an abnormal electrical message. Basically, your brain sending an abnormal electrical message, which is kind of making the widening of blood vessels happen in and around the brain. And that includes the vestibular artery, which is in the inner ear, and that's our balance control system.